Hello, everyone, and I'm so excited that you're all able to join us tonight. I've got an amazing guest here at the Eris Foundation Facebook Live page. Dr. Lyndsey Harper joins me to discuss breast cancer and women's sexual health, a very hot topic here. So thank you so much, Dr. Harper, for joining us this evening.
Yay, thanks for having me. I love to talk about this stuff, so I'm happy to be here.
Yeah, we can't wait. So I'm going to just give everyone a little bit of a glimpse into who you are, and then we'll get started. So Dr. Lyndsey Harper is a board-certified OBGYN and fellow of the International Society for the Study of Women's Sexual Health. In addition, she is the founder and CEO of my new favorite app called Rosy, a company dedicated to creating solutions that empower women on their journey towards sexual wellness. Welcome to the party. This is going to be awesome.
Yay, thank you so much.
Absolutely. So I have so many questions. Our audience has so many questions. So I'm going to be asking you some things, and I invite everyone who's tuning in here. This is your opportunity. We were chatting earlier, and I'm like, Dr. Harper, you're like the Dr. Ruth for breast cancer. You guys, like anything you're ever afraid to ask about your sexuality and breast cancer and everything in between, just go for it, and we will do our best to answer those questions.
Absolutely.
So the first question I have is, if you could share with us a little bit about your background and how you became interested in women's sexual health in the first place.
Sure. Yeah. So I'm an OBGYN. So I help, women through all phases of life. Contraception, STIs, pregnancy, infertility, all the things that we traditionally think about. But in my practice, one thing that kept coming up with so many women really on a daily basis was, Dr. Harper, I love my partner, I love my husband, but I don't care if we ever have sex again. And as an OBGYN, I hadn't been trained on how to help my patients with these issues. And it wasn't just me, it's OBGYNs across the board. We don't really get the training that's necessary to treat really any aspect of women's sexual dysfunction. And so when I realized that it wasn't just a me problem, it was kind of a we problem, and that 38% of women have low desire, 43% of women have some sexual problem or complaint.
Wow, that's a pretty high percentage.
Yeah, it's almost half. 43% of women have some sexual problem. It's almost half of women.
Wow.
And who's there to take care of it, right? I think most people do think it's probably an OBGYN's role, but we just don't get trained to do that. And which is obviously
when you go to school, like sexual dysfunction, it's not on the radar.
It's not on the radar. And so what is on the radar are these narratives like, it's complicated, I'm not a therapist, it takes too much time, it's Pandora's box. Like all of these really negative narratives in training kind of get passed down to younger trainees. And it really does a disservice to us and to women as our patients, because then we automatically kind of shut down when we hear about these problems, which I'm hoping, but I'm certain that some women, have experienced who are watching this. And I really wanted to do something about that. So I joined a medical society called ISWISH, which I then became a fellow of, and really started to understand the evidence-based interventions for all aspects of female sexual health, including low desire, trouble with arousal, trouble with orgasm, trouble with pain, all these really important aspects of female sexuality. And I really wanted to provide women with evidence-based resources so they wouldn't feel isolated or ashamed. And then also their providers a tool to say, you know what, like I don't have the training or really the time or maybe even the interest to treat these things, but I do know of, this tool that was made by a physician in conjunction with therapists that can really be the first step in helping you on this journey and really give that problem and that moment in practice where a woman shares with her practitioner the respect that it deserves, so that she's not told, go drink a glass of wine or go on vacation, right? But she has access to something legitimate and something real that can help her thrive.
Isn't such a horrible idea, but all kidding aside, you need something.
We can't do more.
More than that sometimes.
Totally. And that's definitely obviously not a long-term solution, right? Going on vacation helps a lot of things, and it is great to have a getaway every once in a while, but it's not like giving the problem the weight that it deserves. You know what I mean?
Well, and so for like really digging in and looking at the woman as a whole, that it's not just, you're going through a tough time and, maybe you just need to relax a little bit. It sounds like you really went and did your homework and now have the tools to help us
Yeah.
journey. So kudos. That's amazing.
Thank you. I love it. And we're learning more and more every day. Just like there's not been a lot of training in this field, there's still a lot of research to be done as well. And so we're really thrilled to learn from the women that we serve every day and try to expand the conversation and the field in general so that more women can be recognized and more women can get the help that they need.
Absolutely. So, and thank you for sharing that part of your background with us. Taking it sort of one step further, how did you get into wanting to work and working with cancer thrivers and patients?
Yeah, so it's been just a natural progression of the journey. So we launched Rosy in February of 2019 on Valentine's Day, to be exact.
I didn't even know that. See, a little fact.
That's right. And so, over the last year, we've heard from so many women about the things that we're doing right and how much we're helping people, but also the things that we could be doing better, or maybe the opportunities for helping more women. And one of the most vocal audiences since we launched about the lack of resources were breast cancer survivors and thrivers. And we're hearing from women all the time, oh my gosh, I had breast cancer 35 years ago, and I never have had any of these resources. I've had vaginal dryness this entire time, and thank God for Rosy, and it's like, oh my gosh, 35 years? Like, these things are the messages that we get that we're like, this is unacceptable. This is exactly why we exist. And so when we, got message after message from cancer survivors, it's like, well, this is obvious. Like, we've got to take the next step. We've got to figure this out. And of course, actually, just like you were talking about earlier in our call, this whole idea of like putting it out there, manifestation, and it coming back to you. So this was happening in our world. And then, of course, simultaneously, an oncologist reached out to me. Her name is Shelby Turstrip, and she practices in North Dakota. She's like, hey, I love Rosy. I'm an oncologist who focuses on survivorship. I have this amazing clinical psychologist that works with me. We have a CDC grant. Want to make some content for breast cancer survivors? I was like, of course. And so all the worlds collided, and now here we are about 6 months later. Yeah, trying to get the word out.
Wonderful. That's incredible. Well, we're so glad that you're here to help us. And I mean, I'm 7 years out. I wish that I had you to talk to, but I'm glad I have you here today. Like we were saying earlier, no matter where you are in your breast cancer experience, you always are going to have, issues or questions, and, your body's changing as you get older. So thank you for doing what you do and bringing Rosy to us.
Honestly, it's my pleasure. I love it so much.
So what would you say are some of the most common effects of breast cancer and how the treatment changes women's sexual function? So really, what are some of the major issues that you find that women specifically who have had breast cancer treatment, like what are some of their major issues?
Yeah, I think it's interesting because whenever we talk to oncologists about this who treat cancer and breast cancer regularly, I think this is the conversation that needs to be surfaced, is basically like, here are the treatments you're going to have. For example, that might be surgery, that might be radiation, that might be chemotherapy, that might be, hormone blocker treatment. And here's how that particular intervention is going to affect you, not only whenever they're talking about side effects like fatigue and pain, but also sexually, right? So that's a really important part of the conversation that needs to be happening in these offices when we're discussing side effects. So, for example, if a patient, starts on, if a woman starts on tamoxifen as a hormone receptor blocker, then that's obviously going to throw her into, a medical menopause. And then as a result of that, then there's lots of changes, one of which can be definitely problems with vaginal dryness, which can obviously affect sexual function. We hear about, surgery, just body image changing, relationship with natural breasts and, reconstructed breasts changing, and that whole psychological process and how that can really affect women sexually. It's been really interesting to learn from cancer thrivers about, I've heard, and this I'm sure is not everyone's experience, but it's interesting as a person who's not had breast cancer to understand, I feel disconnected from my breast. I don't really want my breast touch. I allow my partner to touch my breast as is almost like a favor that you're doing, to kind of turn your partner on. So I think these are really interesting conversations that need to be had. And I didn't know them as an OBGYN when I entered this journey. And the only way that I do now is because of this, because of this experience. And so I'm certain that most oncologists and breast surgeons, don't think about those things. And so just the more we can do to say, okay, this is your treatment pathway, and each one of these interventions, this is a natural occurrence. It doesn't mean that something's wrong with you. It doesn't mean that you're broken or that there isn't a way we can fix it. But in fact, these are very common. It's not unique to you. And here are the steps A, B, and C to get you back to where you need to be.
Beautifully said. And I think, having had, breast cancer myself, I think there are actually so many different phases depending upon where you are, from the moment you're diagnosed to, and there are several surgeries, and it's really, I feel like in a sense, it's an evolution.
Right.
And with every change, so, the initial, mastectomy, like losing your breast, like that's, I remember, talk about being disconnected from your body, like, and you put having, your ovaries removed on top of it, we all have
Right.
different journeys, am I still a woman? Like all these questions are running through your head. And then, of course you have a partner and you all of a sudden want to feel sexy on date night. So it's really hard to try and keep everything like wired, so to speak.
Absolutely.
Because we're not, robots, we're human beings. So if you start to change, if the look and feeling of our bodies that we were born with change, then it changes you psychologically and how you perceive yourself and how your partner perceives you. And it's just this whole big puzzle. So I'm just so grateful that someone like you was here to help us kind of put those pieces together. And it's not always easy. And it's
right.
Really a process. I know that.
Absolutely. Yeah. And that's the thing with any real sort of, sexual wellness journey, is it is a process, and it will take time, and it will take work and self-reflection. But I think maybe the two biggest things about that is that, number one, it's worth it, right? Because it's really a choice whether we want to go down that journey or kind of ignore that anything is happening. And if we go on that journey, always at the end of it, we're going to be so thankful and so happy that we did. But it's up to individual women to decide when they're ready to embark on that journey, right? Because it's a lot. It's a lot to think about.
Absolutely. It's something I just wanted to sort of interject. And also, when we talk about sexuality and breast cancer, it's not just for women that are married or that have significant others.
Right.
It's also, if you're single, you still want to stay connected to yourself sexually. And I think that's really important too.
Absolutely. And that's the thing. It's, we know that if we go any period of time where we're disconnected sexually, right? Whether it's because we're single and we don't feel comfortable with that, or because we're, going through a medical illness or a major trauma in life, that it's always harder to kind of get back in touch with ourselves once we've left that realm. And so I would say completely that a lot of the work that all of us have to do during any wellness journey is a lot of self-work. So if you as a single person don't sort of go through that work on your own, you're just sort of delaying the inevitable, because eventually you're going to have to. So the sooner that you start with, coming to sort of appreciate your new body, as you said, instead of the body that you were born with, or come to understand fully through educational tools and through understanding the interventions that are possible for whatever side effects that you're having, you're just kind of pushing it off to the end. So I would say definitely for women who are single and going through breast cancer treatment, it's equally as important to keep sexual health and wellness at the top of mind as it is for someone in a partnered relationship as well.
Exactly. What would you say, what are the four biggest problems that your breast cancer patients face when it comes to breast cancer and sexuality?
Just like we have already alluded to, it definitely depends on where a person is in the journey, but we hear a lot about fatigue as a side effect of medication. Obviously, when recovering from surgery, a lot of women very naturally and understandably just completely withdraw from a sexual relationship. And, there's this change in the relationship sometimes of a caregiver, right, and a care receiver, and that can also really affect a sexual relationship. So fatigue is definitely the most common one. And we can talk about ways to address that, but they would definitely include a medication review with your physician physician, making sure that your labs are all tip top, making sure that you're doing a diet review, and even adding in some exercise. Fatigue and exercise are related, and for people who experience fatigue, sometimes just a short walk of maybe 15 or 20 minutes actually can help to improve that fatigue. Some other really common things we hear about are, of course, vaginal dryness after surgical or medical menopause as a result of breast cancer treatment. So there's lots of opportunities there to help. The most common one, obviously, is a vaginal moisturizer and or lubricant. So a vaginal moisturizer can be used every day to just help you stay comfortable with your own body, right? So it's not for sexual play or anything. It's basically just to kind of keep you from feeling kind of dry and not comfortable. And then a lubricant can be used for sexual play, either with yourself or with a partner. And that is, much more slippery, and then can help to alleviate those symptoms of vaginal dryness, which can then lead to pain. And we want to interfere with any pain cycle as soon as we possibly can, because if you're having sex, if you're having penis and vagina sex and it's painful, then that's going to reinforce the negative relationship that we have with sex, right? So if you're having sex right now and it's painful, then you've got to stop and get an intervention to fix that. Whatever the intervention might be is definitely something to discuss with your healthcare team. But we need to address that sooner rather than later, as to not negatively reinforce that pain cycle, which then leads to obviously avoidance of sex.
Of course. And then unfortunately that can affect the relationship with your partner.
Absolutely.
And they might take it personally and think, well, you don't enjoy me anymore, but really, and then when you're going through treatment, the last thing you need is additional pain and discomfort. So then I guess there's a point where it's like, would you say maybe there are some times throughout the treatment course that maybe sex isn't the best idea, and maybe the couple has to sort of resort to other things?
100%. And that's the thing, that we talk about a lot, that sex is actually like a huge spectrum, right? It doesn't just mean heterosexual, like penis and vagina, right? It can mean so many things. Sex just really means intimacy with a romantic partner, right? So there's lots of ways to be intimate. You can just simply cuddle, right? You can engage in other types of sex that maybe are more enjoyable and less painful. The key to this entire part of the conversation is the ability to communicate about these things, right? And so if you and your partner have never communicated sexually before, or if you as an individual or single person have never really explored things about your sexuality, then that might add an extra layer of challenge to this. But it really should be viewed as an opportunity. Maybe in the past, it's never come to a point where you've had to really, develop the muscle of sexual communication. And unfortunately or fortunately, cancer can be exactly that time, right? Because so many things are changing so rapidly. Not only are you affected emotionally, but also very significantly physically. And the only way that your partner has any idea what's going on is if you're able to communicate these changes. And you're exactly right that without that communication piece, many times partners, take that as rejection. And along with that comes just pulling back from the sexual relationship as a whole. And that can kind of, be very hard to untangle in the long term. So I'm a huge proponent of using anatomically correct language like vulva and clitoris, and also discussing pleasure very openly in partnerships, because, when we have times like cancer or any stressor in life where things are rapidly changing, then we have to have those strong communication skills in place.
Exactly. So I think, with that being said, what is a good way to broach this topic with your partner if things aren't working in the bedroom? It's a frustration, and it's now a strain on an already strained relationship. What's the best way to open up that conversation?
Yeah, I think the best way always is to approach the conversation from a goals-based perspective, because, for good reason. And it's really because we don't talk about these issues. Anything around sexuality can be sensitive for people to discuss, right? And they may automatically assume blame and then with that shame about these topics. And
Right.
so I think a really great way to start these conversations is to blame it on something else. I usually tell people to blame it on Rosy. You can say, hey, this crazy doctor.
Good. I was reading this app.
But in this case, you can blame it on this, Facebook Live. Hey, I was watching this Facebook Live and, these women were talking about these issues. Intimacy with you, my partner, is so important to me, and I really want to keep that as a priority in our lives. I realize we're dealing with a lot of changes, but I don't want that intimate connection, maybe the core to who we are as a couple, to fade away because of these changes. And, this is what I'm experiencing, and I'd love to hear from you kind of what you're experiencing. And that can be just the first step to sharing and facilitating an open dialogue about these issues that I have seen people 100% when they want to talk about it, they become educated about it. They know the options, but literally when the words try to come out of their mouth, they physically can't get them to come out. So, it's nice to have some crutches and tools, even like an article to show your partner, just something else to kind of open the door and start the conversation can be really helpful.
Definitely, because it could be a really hard, topic to address, especially when there's so much going on. Like you're running around, you've got chemotherapy appointments, and where's my prescription? How many pills am I supposed to take? And like you said, also the caregiver component. Like maybe the partner is now also, helping you with your drains, and it's not the sexiest moment. So
Right.
it's a matter of navigating, and I think that's a great piece of advice. I read something, or I saw this app. I want to just sort of open it up. You could even say, I don't even know how to. I wasn't sure how to approach this. I want to talk to you about it.
Right. And like we said, it's really important to me, right? I think that sentence gives it so much weight and really highlights why you're bringing it up. It's not because you blame your partner or because you're sexually unsatisfied or whatever the stories we make up about why we have sexual conversations, but it's really, this is important to me and I want to keep it that way for us and for our relationship.
Beautiful. Well, I hope that helps some of our viewers out there. And certainly if anyone has any questions, pertaining to any of these topics with relationships, how to open it up, feel free to share those questions with us and we'll answer them. So now we're going to do a little bit of a deeper dive. Single ladies.
Yay.
Yay. So, what are some good pieces of advice for the single ladies to be able to thrive sexually during and after cancer?
I think that obviously being single and going through this journey
we're also in the middle of a pandemic. So I feel like for a lot of people, dating is off the table anyway.
Totally. Yeah. There's so much going on right now in the world, not to mention like if you're also, undergoing treatment or have undergone treatment for cancer. So I think that for single people, obviously, a cancer diagnosis can be more challenging, right? You don't have that extra person to run you around or that's built in to do so. Not always that person does that or that single people don't have that, but it can be a little bit more challenging. And I think that could be true in some respects with sexuality, but in other ways, maybe it can be a little bit more straightforward, right? You have only your emotions and your journey to deal with. You're not sort of seemingly taking on anyone else's context or emotions. And so in that way, I think that it could be a real opportunity for single women who maybe have never sort of enjoyed the full expression of their sexuality to then understand the tools that may help them do so, right? So I think as we were speaking about earlier, there's definitely opportunity to start to, come to terms with the new body that now is yours and all of the maybe challenges that come along with that. And that may be, finding a new sense of self-confidence, which you're so great at, Melissa. You know what I mean? And helping women to do, because I think that, there is a bit of a metamorphosis that happens from the patient, right, to the woman that we were all meant to be and who we were created to be, right? Or who maybe we felt like we were before, but maybe we're even a new and better and more vibrant version of that. And so I think that taking that on as a self-love and personal development task can be really powerful. And understanding your sexuality as part of that can be, can amplify that process or journey. And so that could include exploring fantasy, right? So some women enjoy reading erotica, and we know in sex medicine and sex therapy that that's a tool that's been shown to improve desire. And it also can help us explore fantasy.
I would erotica on your app, don't you?
Yes, we do. Yes. So you're so good. But it's a fun part that can kind of open up your mind, right? And many women who are new to sort of understanding these topics or to self-exploration have never read erotica. So in the app, we're very careful to say, hey, do you want maybe just one flame that's like The Notebook, or do you want 3 flames that are like real spicy, And then you can also pick genres that you might be interested in. And maybe you don't know if you're interested in it, but you can always just check and see, right? And that's the place. There's no judgment, there's no shame, there's no embarrassment. And fantasy,
escape, like how many
absolutely
can you watch?
Exactly. Well, and we've seen a huge increase during COVID because people are looking for other outlets to kind of explore things. And one of those ways has definitely been erotica. I think it's such a fun way for women, particularly maybe who are single, to sort of say, oh, well, this turns me on, this is a no-go. And just because you like to read about something doesn't mean that means you want to do it. So fantasy and reality are 2 separate things, and that's okay, right? So we can use erotica to explore fantasy and pleasure on our own or with a partner. And then obviously, I always encourage women to be comfortable with their own bodies, not only the way that we look and the way that we feel, but also the way that we experience pleasure. And so I definitely recommend really regularly self-exploration, also known as masturbation, to women who are kind of coming back into touch with their new bodies in whatever way that might be. And I think it can be a really powerful way to, keep your brain sort of on the positive track with sex, and also to help you understand as an individual and as a woman how your experience of pleasure may be different than it had been prior.
And then doesn't even just the act of masturbation release endorphins, like happy chemicals?
Absolutely. Yes. Well, so anytime that, physical touch does that, orgasm does that. And so this is actually like a stress reducing tool that we can all use, right? During stressful times like cancer, like coronavirus, right? And so we can utilize these really healthy and healthful outlets, in ways that maybe we hadn't been doing before.
Excellent. So to my single friends out there, do your homework, do erotica, go to Rosy, check it out. No, seriously,
there you go.
Great stuff there. So thank you for that.
Yeah.
So here's another question for you. How can women get the help they need to take the next step on the journey to sexual wellness? So if they can't, obviously Rosy is amazing. We can't have one of you in every city, although we'd love to. What would be, would you recommend they talk to their OBGYN? Like what's a good way for them to get some one-on-one help with this?
Absolutely. I think that, the first part is just what you talked about, is just kind of being aware and being educated. These are my problems, like just putting a name to it, right? I'm having pain when I have, penis and vagina sex, or I couldn't care less about sex, so that's low desire. Just really taking some time to reflect, maybe through journaling, what is going on, right? Like what exactly is it? And then once you've identified that, I would say definitely to start by reaching out to members of your healthcare team, whether that is your oncologist, whether that is, your surgeon, whether that is your OBGYN, and saying, just starting the conversation. Hey, you can cover whatever else you want to cover. I have something I'd like to talk about, which is how, I feel like my sexual function has been affected. And then you can just share with them. It doesn't have to be fraught with, anxiety and embarrassment. We're physicians. We may not have all the answers, but we certainly can have conversations about these things. So definitely OBGYNs are well versed to take care of vaginal dryness, most types of sexual pain. Pelvic floor physical therapists can be of a lot of help. Sex therapists can actually be wonderful resources where you can go and work either alone or as with your partner on issues that may have come out of a long-standing, problem such as pain or low desire. So I would say that my advice would be to not stop, right? Unfortunately, as we discussed earlier, a lot of physicians aren't trained to really care for these issues wholeheartedly or 100%, but that doesn't mean that no one in your community can, right? And if your physician or your healthcare team member is not able to, then just simply ask for the next step. Like, do you know anybody in our community who does this? And if not, then there's some great resources. ISSWSH, ISSWSH.org has a list of providers that you can search by, I think, city. And then ASECT, and they're sex medicine doctors like me. Actually, and all types of people. There's sex therapists in ISSWSH, pelvic floor physical therapists, so people all in the community. And then also ASECT, AASECT I think it's .org, is the provider sort of hub for sex therapists. So you can visit either of those websites as well to try to find someone in the community. But the resources, what I want to communicate most is that the resources exist, and that women, as many of us have experienced, we have to be our own healthcare advocates, right? I'm sure you've experienced that in your journey. And this is another instance of that where we have to keep asking, we have to keep pushing until we get the answers that we need, because they do exist for all of these problems.
I'm hoping that there'll be more of you, especially, unfortunately, I don't think breast cancer is going away anytime soon. And, there's no reason for women to suffer. And for the relationships to suffer. So hopefully there'll be more help in this area, and there will be more OBGYNs that are well versed and trained in this area, and that it's sort of just comes with the territory of dealing with cancer. I mean, it should all be part of the same.
Absolutely. Yeah, it should be part of the training. It should be part, and just like it is for men's sexual health, right? They have tons of resources, tons of medications, tons of ads, tons of, doctors, and we should expect and actually demand the same for female sexual health. And so that's a big part of our journey, is to train residents and to disseminate information that's very just clear and straightforward and tries to demystify all of this narrative about everything being so complicated. There are lots of factors at play, but that doesn't mean we can't do anything about it. And it's actually an opportunity really for us to come together as healthcare teams and really show our patients, you know what, we care about you as a whole person, not just as a cancer or not just as a whatever the diagnosis is, and we want to see you thrive. And this is all about, thriving and doing so, in a way that really represents and respects us as whole people.
Absolutely. Because, it's interesting. Like I speak to all kinds of brands, and I was just speaking with someone that has like a skincare brand. And we were saying, just because you have cancer doesn't mean that you need some totally special skincare brand for cancer.
Right.
These are symptoms, and they're most of the time temporary, and they should be treated as such, because I'm sure there are other illnesses and other treatments that create these issues as well across the board. I'm sure it's not just unique to breast cancer patients.
Absolutely. And that's the thing, is that there has to be a comprehensive approach to women's sexual health in all aspects of medicine. When we start a new medicine for some patient, we need to tell her the sexual side effects that exist. When we offer surgery, she needs to know how that will affect her sexual function. So it needs to be integrated. It's going to take a while for us to get there as a medical community, but I do think we're making progress. Since I've even been in the field, we've made progress. But it's not fast enough, right? It never is. Progress is never fast enough.
Never.
But it takes conversations like this, and it takes people to speak up and say, you know what, that sounds exactly like my experience, and I deserve better resources and deserve to be able to talk about this.
Absolutely. I couldn't agree more. Totally. And what would you say are some common and effective tools or products that women can use if they have vaginal dryness,
Yeah.
Pain. I mean, pain. I was in I was at a meeting once. It was a panel discussion about breast cancer and sexual health, and it broke my heart because there was this woman, and she was just so sweet, and she had like tears in her eyes because she said, my husband and I we haven't had sex for a couple of years. It's just like just the thought of it. So what are other treatments? Like, let's just take, let's start there first. Like for someone that has, because I know there must be other women out there, and it breaks my heart that literally cannot have sex because it hurts so much.
Absolutely.
Where do you begin in, let's say, an extreme situation like that, where the thought of it is just like they can't?
Yeah. So, the real thing that needs to happen is an exam, right? An exam by a physician or another qualified member of the healthcare team where, we take a look and we say, hey, what is causing this pain? Because there can be several causes of pain with sex. The most common one is vaginal dryness, right? And that's as a result of the lack of estrogen. So that could be because you're taking tamoxifen or similar, or because you've had your ovaries removed, right? In the case of a oophorectomy. And yes, right. And so the vagina depends on these hormones that are made by the ovaries and that are blocked by these medicines to keep the vagina sort of plump and elastic and moisturized. And so when we take that away, the vagina goes and it gets really sad and dry and not elastic. So it can't really stretch like it used to.
Uh-oh. Can you hear me? We're having a little sound issue. Uh-oh. Yeah, maybe, do you want to go off? I think she's going to come back in a moment. It's funny, we were just saying before we got on this call that something like this might happen. And if it does, this is how I roll. So I just want to say again, I want to thank everyone for joining us tonight. Dr. Harper is going to join us in a second. She just lost sound for some reason, but don't be shy about asking questions. We'd love to hear from you guys, and we're here to answer any questions that you may have.
Can you hear me?
Yay! And I was away. Thank you everyone for your patience. See,
absolutely,
it happened, and it did.
Oh well. Okay, so tell me where I dropped off. Sorry.
So the last thing I heard was sad vagina.
Sad vagina. Makes me sad. Okay, so when we think about going from the least invasive treatment and risky to the more invasive treatments and risky, we can kind of organize the conversation that way. So the easiest place to start for vaginal dryness, which can result in sexual pain, is with a vaginal lubricant, right? So we talked about that a little bit earlier, a moisturizer or a lubricant. And a lot of cancer patients love lubricants with hyaluronic acid in them, or HA. And so some brands that I'm familiar with are Hylafem or Fem Pharma. They make these HA lubricants that you can place in as a moisturizer, so on a daily basis, or as a lubricant for sex. And that can make things exceedingly more comfortable very quickly. And there's no hormones in them. You can get them over the counter.
So the chemical you mentioned, the
hyaluronic acid, I actually put it on my face every night to try to keep my skin plump. And it does the same thing for the vagina as well.
Wow, yeah. It pumps everything. Okay, we like this. So is it, for lack of a better word, because I know so many women now are so mindful about using chemicals that's not clean or not natural, organic. Would you say that, where does that fall?
That's a good question. I wouldn't say that it's organic because it's a chemical made in a lab, but it's not a harmful chemical, Right. And whenever people, I don't know, I'm like, everything's made of chemicals, like the world are chemicals.
Like maybe you're gonna be a vegan, but like if you are having sexual major dysfunction, like this is something that.
Certainly. And if that's not something that you'd want to try, you could certainly start with a water-based lubricant first. Or a silicone-based lubricant. So there's lubricants. We could do a whole nother Facebook Live about lubricants, Melissa. But
okay, there's lubricant. But there must be Lubricant Awareness Month somewhere.
I'm sure there is. I could just like pop out my samples, show you how they feel. But yeah, so the biggest thing is that, and actually there's a website that I'll think of in a minute that was started by a gynecologist named.
How excited you get when you talk about lubricant? You're so
I'm easily excitable. Let's be honest. So the gynecologist name is Barb Dupree, and it's called middlesex.com. And you can go on there, and she has tons of great content actually about menopause. I think that there is some stuff specific to cancer on there, and you can actually order a sample pack of lube from her, which I love. So it's got like 10 or however many samples, like little sample packets, so that you can try it out. Because a lot of times you'll try one and it won't be for you. Right. But then when you find one, it's like, all the stars align, and it's amazing.
And you're like, yay.
It's amazing. So it's great to just kind of, experiment and see what is right for you. So I would say lubricants and moisturizers are kind of the least sort of invasive and risky way to start. The next place that you want to consider, and this is a conversation to be had with your oncologist for sure, are vaginal hormones. So some oncologists are comfortable with prescribing vaginal hormones for vaginal dryness after cancer, and some are not. It all depends on your cancer diagnosis. It all depends on your oncologist. There's a lot of people involved in that decision, but it is an option for some women. So it's a conversation worth having. If you've tried the lubricants and moisturizers and they're not working, then definitely consider some vaginal hormones. And that could be in the form of estrogen. It could be in the form of DHEA, which gets converted to estrogen and testosterone. So there's a couple of.
So isn't that like a no-no if you're dealing with breast cancer? Like you don't want to have.
So that's the thing. It depends on the type of breast cancer, right? And it depends on the oncologist. And the people who are in this field, like me, we know that most of those hormones are absorbed locally, right? So they're just in the vagina. They don't make a difference in the bloodstream. But once again, it's a highly individualized decision. And obviously many patients who have survived breast cancer are not getting anywhere near any hormones. Right. So it's, that's a conversation to have with your practitioners for sure.
Yeah, but the minute I was diagnosed with breast cancer, I was on like the tiniest bit of hormones. They were like, they took it off at lightning speed.
Right. And that's the reaction that a lot of people experience. So it's an individualized decision for sure. The next step could be something like, it depends on if you're having dryness, then probably the next step wouldn't be physical therapy. But if you have pain due to something else, for example, if you've had a hysterectomy with an oophorectomy and the vagina is just kind of small because of surgery, or you've had low estrogen for a long, long time, say 20 years, and the vagina is really a lot smaller, then definitely physical therapy can be of a lot of help, because it can kind of work to open up the vagina a little bit more so that you can have penetrative sex. And then, there's something called vaginal dilators, which I think most people in this community are familiar with, I would hope, but if not, then they're basically pieces of the material can differ, but it can be plastic or silicone or even glass that go in the vagina, and they get progressively bigger so that you can start with a very small one and then progress to a larger one, however large you want to accommodate, whatever penetrative, if it's a penis or if it's a, whatever sex toy. And that can help to be a lot more comfortable. And then there are also laser therapies that are available. These haven't really been well studied in cancer patients, so we approach these with caution. We have good data for menopausal patients, so separate from cancer patients, but a lot of physicians do use lasers in the vagina. And after obviously a very thorough discussion of risks and benefits, but it can help to revascularize the vagina, so bring some more blood flow to the vagina, and also to help the collagen come back to kind of plump it up, like we were talking about the hyaluronic acid does, to kind of bring back that moisture to the cells of the vagina as well. So these are all conversations. I never want to say that one treatment is right for anybody other than probably the lubricants. Those are pretty easy. But the rest of these definitely have to be made in conjunction with your healthcare team based on your individual risk factors. But there's something on that menu, that can help you for sure.
Wow. So is it safe to say that if you're having even extreme pain and discomfort, whether with or without sex, that there is going to be some treatment or solution that's going, it may not solve it 100%, but it will give you some relief.
Absolutely. And our goal would be really to get you to a place where you can experience pleasure, where you can understand, if there's anything that exacerbates your symptoms, how to avoid those, to really optimize the situation. Try really, all the tools in the toolbox until we kind of get to a perfect state where women can go back to, enjoying intimacy and pleasure.
And thank you for that. Is there a point, like maybe when you're in the middle of chemotherapy treatment, that you would say to the patient, you know what, let's put this on the back burner for now. You're in the middle of treatment. Let's deal with it later. Or is it really case by case?
It's absolutely case by case. And it's never something that I am going to say, hey, like we need to do this now. It's really when a woman or when a patient is ready, right? Because as we discussed, there's a lot that goes into this. And unless a woman is ready to kind of think through these things and work on these things, then it's probably better to wait, because otherwise, the outcomes aren't going to be great. We might get into, a situation where, it's just better to kind of hold on until someone's ready to say, okay, now I'm ready. Now I'm here physically, I'm here mentally, and I'm ready to kind of move forward on this. So it would definitely be a very personal case by case decision.
Got it. Thank you for that. And, something I'm sure that a lot of the women that are watching is, what if you're about to start chemo? Is there anything you could do preemptively to prepare your body so that you don't have the dryness, you don't have the pain? Is there anything that you could do proactively?
It's a good question. I would say just before maybe you had pain, to just go ahead and initiate lubricants if you never have before. I mean, women who have regular lubrication and normal levels of hormones still use lubricants. They're known to just enhance sexual pleasure just in and of themselves. So I would say, if you could avoid ever having pain, that would definitely be the best outcome. And probably the best way to circumvent that is just to always use a lubricant from the very beginning of your journey.
Right. Okay. Great advice. Awesome. So I think that, I don't know if I have any more questions. Like, is there anything else that you wanted to share with us tonight about, breast cancer and sexual health? Like, any other tips that we didn't cover up on?
Yeah, I think that just from like a philosophical place, that I just want anybody who's watching to know that, these issues are super common, that there's nothing shameful or wrong with having these types of issues. And just because no one's brought it up doesn't mean that, it's not a really big issue, not only for you personally, but just generally amongst women, especially survivors and thrivers. So I would say to not let that hold you back. Whatever fear or embarrassment you might be feeling, just to try to, as much as you can, push through that with your partner, with your healthcare team, and with yourself, so that, the next phase of your life can be maybe even better than the one before. And this can be part of that journey. Absolutely.
I couldn't agree with that more. And I'm just so glad that, we were chatting earlier. We'll share with everyone that, sometimes this topic can seem taboo, because it's not, especially when you're going through cancer, like it's not something you can necessarily talk to your mom about, or even your friend, because they haven't gone through it, So I'm just so glad that we created this safe place for women to know that they can come to talk to you, to me. And, we could probably talk about this stuff all night. And I'm just so excited that the Heirs Foundation is going to, invite us back and talk about this some more.
Me too. Yeah.
Other like subtopics that we didn't even go into, for the sake of time. But I mean, menopause, chemotherapy, or even like, someone like me that's 7 years out. Like, what does that look like? So many.
Absolutely. It's definitely not a one-stop shop that can be covered in an hour, but it is important for women to know, that resources exist, that they're not alone, and that it's well worth the journey.
Absolutely. Well, I cannot thank you enough for joining us tonight. And I think we were joking earlier. I was like, what's in your cup? Is that a Cosmo?
So pouring all water.
Another day, that'll be another Facebook Live where we can have Cosmos and talk about this stuff.
Perfect. I'm totally in, Melissa.
So in the meantime, I just want to let everyone know that women more than ever before need support with reconstructive surgery after mastectomy. And the Heirs Foundation, who I love, has been helping women before the pandemic and will need your help to help women after. To help these women in need, any amount is greatly appreciated. So you can go to the Heirs website, which is heirsfoundation.org. So you can go there for information. You can go there to make a donation. But most importantly, if you are getting ready for breast reconstruction, you can apply for a grant if you need help. And even if you have insurance, this is very important, something I didn't know before, you can also apply for a grant. And thank you to the Heirs Foundation for everything that you do and for creating this platform tonight for us to chat. And all I can say is keep your eyes peeled for more details, for more chats like this. And Dr. Harper, thank you again. I adore you, and I will be chatting with you very soon.
Sounds good. Thanks so much for having me.
Thank you for joining.